Hey doc, should I pick braces or clear aligners for my treatment? This is a question we get asked all the time by adults in our office. In this video, we're going to discuss which treatment is right for you. Hey everyone, I'm Dr. Jesse McGuire, the owner and orthodontist at ProSmiles Orthodontics in Goodyear, Arizona. Welcome to our educational videos where we look to offer you valuable information regarding all things orthodontics. We serve patients of all ages from 7 to 77, and we proudly serve the residents of Goodyear, Avondale, Litchfield Park, Surprise, and even Buckeye. Again, thanks for joining our video. Adult orthodontics is rapidly growing in the field of orthodontics as adults look for new ways to live their best lives. With adults being a growing population in the orthodontic community, these patients are looking for aesthetics, convenience, and excellent communication from their providers. But doc, I'm too old to start treatment. There's no time like the present to get started. And here are some great reasons to get started on your treatment as an adult. Improving your chewing function is a basic one. The more straight your teeth are and the better they fit together, the better you'll be able to chew your food. This could also help you with your digestion. Having straight teeth makes it easier to clean your teeth and your gums. To improve your overall smile aesthetics is another big one. And the last, and what might be the most important, is to get you on the right track with your overall dental health. Regular dental offices seem to create a lot of stress and anxiety with patients. So walking into an orthodontist office where it's a little less stressful might be a way to just get you back into the dental community. So we welcome you. If you haven't been to your regular dentist in a while, this might be a great place to start. Once we see you as an orthodontic exam, we can always refer you out to one of our partner dental offices to make sure you get the care that you need. While these are awesome reasons to get started as an adult, there are a few realities that we face when working with adult patients. Here are a few unique challenges that adults face. Periodontal disease and bone loss. Now this is a big one and the biggest one. And this is a devastating disease. I really can't emphasize that enough. This has to be under control before you start your orthodontic treatment, no exceptions. Missing teeth and collapsed dental arches is also another one that we see pretty commonly with adult patients. Now, everyone has a different dental story and dental history coming into the office, so sometimes we see patients that didn't have the means or the abilities to take care of their teeth when they were younger, so they had a couple teeth taken out, they've lost a couple teeth, unfortunately, and so we're really setting these patients up for a pre-prosthetic phase where they're looking at getting implants or partial dentures towards the end. TMJ and TMD disorders, or temporal mandibular joint disorders, are also some things that we see in adult patients that we really don't see in our younger populations for the most part. The signs and symptoms of these TMJ problems can include popping of your jaw joints, clicking, and some pain. Now, generally speaking, these don't affect your orthodontic treatment, but when they do, they tend to be pretty severe and may even require a surgical intervention along with your orthodontics while you're in treatment. As an adult, these are the realities, both good and bad, of going through orthodontic treatment. But don't worry, the time and finances and energy you spend investing into your smile and your bite will pay dividends in the end, and you'll be super happy that you went through treatment as an adult. So let's fast forward and say that you've already seen your general dentist, you've been cleared, and the dentist has referred you to our office. What's the next step? Deciding between traditional braces and clear aligners. In order to get the best out of your orthodontic treatment, the correct tool must be used for a given situation. For example, this is a hammer, this is a Phillips screwdriver, this is a screw and some wood. In order to screw this screw into the wood, I could use the hammer, but it's not the best tool for the job. A screwdriver would be much better and more efficient to screw this screw into the block of wood. Now, in simplest terms, that's kind of how we think about orthodontic treatment sometimes. There are given situations that are made easier with braces And there are certain situations that are easier with clear aligners. Also take into consideration what you as the patient desire for your treatment, but sometimes we have to use our professional judgment and kind of overrule what you desire as a patient so we can give you what we promised you in a great bite and a great smile. And so we have to make sure that we pick the right tool to make sure we get through your treatment efficiently and safely. Those are two very, very big important things. Now, let's talk about some advantages and disadvantages of both braces, traditional braces, and clear aligners. Braces can be used for all treatments, from the most simple to the most complex treatments. There are multiple aesthetic choices with braces these days. We have traditional metal braces, we have clear braces, and we even have gold brackets. Compliance with braces is generally speaking automatic. Now, all of my orthodontists out there know that that is 100% true, but for the most part, compliance is easier with braces than it is with clear aligners. Braces are also reliable and predictable, and they're adjustable on the fly. We've been using braces in orthodontics for over 100 years, and during that time, we've had a lot of time to fine-tune the systems that we use as far as traditional braces goes. Here are some disadvantages of braces. They're super hard to keep clean, annoyingly hard to keep clean. Between your wires, the brackets, a power chain, it's really difficult sometimes to get into those tight spaces to keep everything clean. Patients might feel like their teeth are yellowing with traditional braces on, and they may feel like their overall oral hygiene is decreasing a little bit. Having braces on really adds like an extra 10 minutes to your morning routine so you can brush and floss and keep everything clean. The aesthetics of braces can also be a disadvantage as well as an advantage, because adults generally don't want to have a metal bracket or any bracket attached to their teeth. So whether you're in sales, whether you're in modeling, if you're an educator, having something attached to your teeth is just not an ideal situation. Another big disadvantage of braces is diet modification, where you now have to cut up your foods, eat smaller portions, softer bites, and avoid hard, crunchy, sticky, and chewy foods. While having braces is a great reason to start a diet, it's not really fun when you just want to binge on something on like a Saturday night and watch Netflix and chill. Here are some advantages to aligners. Aligner aesthetics. Now this is the mic drop moment right here. This is why everybody wants to go into clear aligners. You can't see them. You can't see anything on your teeth when you're wearing them. They're practically invisible. And this is where all the excitement has been generated with plastic. You can wear them, you can be in treatment, and no one will know. They're easier to clean and maintain your oral hygiene. So when you want to clean your teeth, brush your teeth, floss your teeth, you just take your aligner out. And then you can do everything as normal, take your normal 3 to 5 minutes, get everything super clean, pop your aligners back in, and you're ready to go. There's no diet modification. You can eat all the same foods with aligners on as you did when you were not in treatment. Now granted, you have to take your aligners off to eat every time, but you don't have to avoid all the hard, crunchy, sticky, and chewy stuff, and you can still eat everything you want. Clear aligners are excellent for retreats and simple cases. So the chances are, if you've already had braces once, aligners are going to be a great alternative to traditional braces a second time, so you can get your teeth straight if they moved, if you lost your retainer, or if things kind of shifted around. Here are some aligner disadvantages. Attachments are required on some or all of your teeth. Wait a minute, doc, you just told me I didn't have to have anything on my teeth. That's kind of true. With aligners, since it's just plastic, there are certain movements, the more difficult movements, that require an attachment that's made out of composite. It's the same thing that they use to fill your teeth. Composite attachments or engagers that allow the plastic to grab onto something so it can move your teeth for those more difficult movements. Now, the frustrating thing is you may have one attachment, or you may have one attachment on every tooth. Or you may have multiple attachments on multiple teeth. This can be extremely frustrating for the patient that got into aligners because they didn't want anything on their teeth. This is something you'll find out with and have to discuss with your doctor when you show up for your consultation. Another thing with aligners is 100% compliance is required. This is because the aligner trays do not work if you're not wearing them. So we require 22 hours out of a 24-hour day, your aligners have to be on. This is the biggest challenge with aligner treatments. Short of eating and brushing your teeth, the aligners always must be on. Aligners are limited for the most part to mild or moderate cases. While aligner technology has come a long way, there are still some more difficult movements that we just haven't perfected with aligners. This means we can't correct some things with the consistency and the predictability that we would like, which makes it hard for us as practitioners to promise you a great result when we know there are some things that are 50-50 with aligners. In situations like that, traditional braces are a much better alternative. And lastly, with aligners, you have to remove them every time you eat or drink something. That coffee first thing in the morning, gotta take them out. Mid-morning snack at 10 a.m., gotta take them out. Lunch break, gotta take them out. Afternoon Starbucks to get you through the day, gotta take them out. And so on and so forth. Now, obviously, you're not gonna wanna eat something really quick and then pop your aligners back on. This means you have to brush and floss when you take your aligners out and before you put them back on. So every time you eat, expect to brush and floss and then pop your aligners back on. This obviously takes a lot of time. It can be another frustrating thing with aligners and adult patients. As your orthodontic professional, our job is to listen to your concerns as a patient and also provide you with the best, most efficient, safest, predictable, and consistent solution to your problem. We always take into consideration what a patient wants and desires, and we also have to use our doctor power to make sure that we give you the best treatment for your particular situation. And everyone's different. So you can't really compare what your brother or sister went through or your coworker at the job. You definitely have to come in, have your consultation done, and have your treatment plan custom made for you. So what is the right tool for you? The best way to find out is to come into our office for a complimentary consultation. Now, we at ProSmiles Orthodontics would love the opportunity to earn your business, and everything that you need to know to book an appointment for our office can be found in the top comment of this video. That includes a link to our website and also a link to our real-time scheduling website. There you can book a date and time that works best for you and your family. Hopefully I was able to provide you with some valuable information today. We spread our message about our office through video, through Facebook, and we would love for you to help us spread that message by liking our videos, sharing, and tagging a friend who also may be interested in clear aligners or braces. From ProSmiles Orthodontics, I'm Dr. Jesse McGuire, signing off. Everyone have a good week. We'll see you soon.